Good morning, Mrs. Robinette. I'm Tori, and I'm with the Respiratory Care Department, and I'm here today because your doctor has an order for us to draw your arterial blood gas. Okay. So what that means is that I'm going to be drawing blood from your arteries instead of your veins, which is what you've had done previously during your stay here at the hospital. The difference with this type of blood draw is that blood that comes in your arteries is oxygenated versus the blood that's in your veins, which is deoxygenated. And so by drawing this sample, I'm going to be able to tell how much oxygen is in your blood as well as how much carbon dioxide you're retaining. And so with the information that we get from your sample, I'm going to be able to look through those results, and I'll be able to help you breathe better once we get this sample drawn. Okay. Can I have you verify your full name and birth date for me, please?
Cheryl Lynn Robinette, 11/1/52.
Okay. I just want to check your chart, Cheryl, to make sure I don't miss anything important. Okay, and we're going to go ahead and get a quick set of vitals. I'll get your pulse, your respiratory rate, your heart rate, and your temperature. Get a blood pressure too. And I'll go ahead and wash my hands. Okay, I'm going to have you hold your wrists out like this for me, palm side up on both sides. I'm going to feel which one has the strongest radial pulse, which I think this side does. So what I'm going to have you do is lay your arm on this towel like this with your palm side up. Can I just loosen that?
Oh, take it off if you want.
Just like that for right now. Okay, so I'm going to go ahead and wash my hands here. I've got everything all set up. So go ahead and get gloves on, and then what I'm going to do is just clean the skin with an antiseptic wipe so that we can make sure the area is clean before we penetrate the skin. Okay, so I'll go ahead and wipe the skin here, and then I'm going to wipe the tips of my gloves as well. And then before I actually would do the poke, after I found your wrist, I would do what's called the Allen's test. And so what I would do is I would have you make a fist for me with this hand, and then I would occlude both your radial and ulnar arteries. Okay, make a fist. Now open, fist, open, fist, open. See how your palm's white?
Mm-hmm.
When we release the ulnar artery, when you see the color come back to your hand, that is telling me that you have enough blood flow for us to do this procedure. And so that's why we do that test before a draw.
Okay.
So I'll go ahead and real quickly clean this area again and clean my gloves. Okay, and then looks kind of sad. And then go ahead and take the cap off my needle here. Okay, and then I'm going to feel for your pulse. Okay, right there, you have a really strong pulse. So bevel side up on my needle. I'm going to draw back to the amount of blood that I need. Okay, and then at a 45-degree angle, okay, you're going to feel a poke. Okay, and then got blood flowing in, so I hit your artery. That was good. Okay, and then once my needle's full, I'm going to go ahead and apply pressure to the site of puncture, and I'm going to use my safety shield on my needle so nobody gets poked. Okay, and then I'm going to hold that on your wrist for 3 to 5 minutes until the bleeding stops, and I'm going to be looking for swelling, redness, excess bleeding, or any pain that you might have. And then once our bleeding stopped after that 3 to 5 minutes of pressure, I'm going to go ahead and put a Band-Aid on there. All right, and you're all set to go there, Cheryl. So then I'm going to take my sample, and I'm going to blow any air that might be in there out. This is going to get labeled with the label that's filled out with your information. It's going to get placed into my biohazard bag and sent to the lab. And then all of my sharps are going to be placed into a sharps container, and I'll have to disinfect the area. Do you have any questions for me, Cheryl, about what we did today?
No, you explained it quite well.
All right, thank you very much for coming in.
You're welcome.